name for a minute. Doc Hawk. What am I going to call you really? Hawkeye, Doc Hawk, whatever it is.
Sidekick is fine.
Yeah.
Whatever.
Goof. This morning we have a really special guest, and we always do, but this morning we have a really special guest. Anil Garmucker, I think I got pretty close, lives in rural Kansas around Parsons. He is a father of 19.
Nine.
And Neil, I said 19, didn't I? Man, you have been really busy. A father
That
of
would
9.
age you even more.
Yeah, you would be. And a COVID-19 survivor. He started getting sick April the 18th and was diagnosed with COVID-19. By April the 24th, he was hospitalized in Parsons, and by the 26th, he was life-flighted to the University of Kansas Health System, and he was a very sick man. Today, he is COVID-19 free, and he joins us in the studio. Welcome. We are going to hear his story in detail in just a moment. And it is an amazing story. And it's a story of triumph and survival, but still hardship. And we want to reflect about that and talk a little bit about what that means to be a COVID-19 survivor, especially having been as critically ill as Anil was. But first, Dr. Hawk, how are you doing?
Hi.
Good morning.
Well, the last few days, our numbers have been creeping up.
They have.
Even in the last 24 hours, they've kind of gone up and down by a couple of patients. Today, we do have 25 in hospital, which is up from especially where it was last week. 8 of those are in the ICU, 2 are on the vents.
That's the good news.
That
we're
is the
staying
good
the
news.
two on the vents.
And we're trying to really hold back from putting somebody on the ventilator if we don't have to. Unfortunately, though, our age ranges, even in the ICU, 32 to 83. So we have young people in the ICU. In addition, we have 2 pediatric patients as well in the hospital. So we do have an age range. There are younger people in the hospital as well.
32, that means I could almost be in the ICU, right? Because I'm like, 28
You're close,
or 30.
yeah.
I'm
You're
closer.
almost, yeah.
It's
You're
good.
only a few years out.
Yeah, just a
They could
couple.
put you in pediatric.
Yeah, they could. Some would argue that's
Benjamin
where I belong.
Button. That's right.
Anil, tell us what happened.
I was delivering a load in Indiana, and I felt like I had allergies, or I had a bout with pneumonia in March, as the case would be, and I had recovered from that. And after the delivery, I just started to get really tired and really winded. And what would normally take me about a day to get back took me about 2.5 days to get home.
And that was just because you had such a hard time breathing.
Yeah, I would get really winded and really tired and fatigued. And I think on the last day I was more productive because I had figured out I was getting more oxygen if I was breathing more shallow through my nose. So I was doing more repetitive shallow breathing.
Wow.
And I remember parking the truck and getting home, and I just collapsed, on the couch. And we did a telehealth visit with my doctor, or with urgent care in town. And they prescribed a bunch of stuff, inhalers, some antibiotics, some steroids. And I think my wife was watching me, and she said my breathing was getting worse. And my mom came home that night from her travel nursing, and she had a O2, one of those finger sensors.
Yeah, oximeter.
Yeah, which I carry all the time now. And as she was watching my oxygen get down, under 90 and into the 80s.
She was like, yeah, we're not waiting.
Yeah, she, and I guess we weren't really thinking COVID at the time.
Yeah.
I mean, my wife was sanitizing stuff and people were staying away, but she was keeping an eye on me. But my mom, even being a nurse, she wasn't wearing any PPE when she did the 20-minute drive to the hospital. And it's interesting because they changed all their procedures after I went to the hospital. So the first time I got into the ER, I was able to walk in by myself. And they let me in the waiting room and triaged me. And they took me into a room, and I think they said based on the oxygen levels and the blood work, they were presuming that the test was going to come back positive. So I think I saw the nurse once or twice, and I saw the doctor once. Then after that, they called me in the room. They didn't want to come in. And they actually at first tried to talk me into taking an oxygen tank and going home. And I was kind of,
A little
Not-
reluctant on that one.
yeah, I didn't really want to be around anyone at home
Yeah.
for quite some time until, if that's what it was. So they did transfer me upstairs for, I think they said observation. So it was a regular room for the first day. Started off kind of low on oxygen, and they gave me Tylenol, I think. And I had a friend that was a nurse working in New York City, a critical care nurse, and she was talking to me, and she was actually yelling at me to get in a prone position, you know, as things got worse, which was really uncomfortable. But it gets kind of hazy there, but they kept increasing the oxygen, and I think at some point in time, my heart rate started getting erratic, or they had problems with it,
Yeah.
and I was having trouble keeping up with I think they had it at 15 liters.
Yep. That's a
And-
lot.
Yeah.
Just for the audience, it's, that's about as much as we can do without putting you onto life support.
Yeah, they found out later I was really the first critical COVID patient they saw.
Okay, Parsons.
Yeah, and I think they might have had 2 or 3. They might be at 4 that they've had hospitalized in 4 months. So at some point in time, they had a pulmonary specialist that checked in on me on a tablet or a robot.
Yep.
And they had decided that they were at the end of their capabilities. And they had, they gave me an hour to talk to people before they were going to put me on the ventilator. And I wasn't really talking. I think I was texting more than talking at that point in time. And I talked to my wife a little bit, mostly about how to take care of the business while I was gone. And I mean, I knew the odds were not in my favor, being diabetic and going on a ventilator. And the news wasn't good everywhere. So I was kind of,
A little scared.
I was definitely starting to have conversations with God. You know, I didn't know if I was coming back or how long it was going to be. I mean, if I look back, I wish there were things I would have said to people I cared about. I mean, I thought just preparing her to be okay while I was gone was the best I could do.
Yeah.
But it was definitely, I mean, past that point, I know I didn't eat for 3 or 4 days while I was there, the whole time I was there. And it was just, I mean, I don't remember if I was sleeping. I don't remember.
You don't
What?
when you're in the ICU.
Yeah, it was definitely,
And then eventually you got bad enough they transferred you up here to the health system with the KU.
yeah, that I don't know.
You don't remember that
I
part?
don't remember that.
You did end up here. You remember that part?
Yeah, I do remember that. I thought it was China, but
That's actually good. You tell it was China. No, it's not China. One of the hard things about critical care is you don't remember much about when you're that sick, but actually one of the very best things you don't remember much. Because the people, I think, would have a lot more post-traumatic. It's traumatic enough being in the ICU because I'm an old ICU doc, and it's just really hard. But fortunately, people don't remember it as much. So talk to us about what happened when you did start to remember and that start coming around like, oh my gosh, what's going on?
well, I mean, I had some really weird, I think what my mom called it, the ketamine cave.
Yeah,
I had some really, really weird,
dreams.
I remember vaguely like getting woke up and being told to calm down when they told me to wiggle my toes or
Yeah.
whatnot. And I think I definitely had a tendency to pull things out because when I woke up, I was restrained and had the big mittens on.
Yeah, patients do like to do that, especially, and it's hard because you get really disoriented and the sleep-wake cycle's all goofy in an ICU and stuff, so,
Yeah, I remember trying to take the mittens off with my teeth a few times.
yeah. How long were you in the ICU?
I believe with the ventilator time,
Yes, sir.
I want to say 10 days.
Okay, so felt like an eternity, I suspect, to your family. What, and then how long were you in the hospital once you got off the ventilator?
I want to say 5 days.
Okay, so then you got some pretty rapid improvement once you got to that point. So you've been out of the hospital for, gosh, about 2 months, is that right? A little more than that, maybe?
The first time, yeah, about 2.5 months.
And then you had to come back to the hospital?
Yeah.
What was that about?
I had inflammation, and my throat swelled up and I couldn't breathe.
Yeah, so they had to come in and give you some steroids. Did you have to go back on life support then, or on the ventilator?
I did not, fortunately.
That's good. And how are things for you now?
I'm still taking pretty high doses of steroids,
Yeah,
and every time we try and come down, I think they call it stridor breathing,
yes.
and the swelling on the throat comes back.
And that's a complication they're thinking may be related to both COVID, but really probably more just trying some of the life support. And you mentioned you had some neck surgery as well. So that probably all fit together then.
Yeah, I guess it was the perfect storm.
It was a perfect storm. How about the COVID stuff? Do you feel like your strength is getting back? Do you feel like you have any fevers or chills anymore? Or how is that part going?
Most of that's gone. I still have, like I said, the inflammation stuff. I still have trouble with stamina.
Yeah.
You know, I tried jogging with one of my daughters, and I think I can get like maybe 70 yards.
Well, hats off to you even try jogging. That's impressive. Let us get through that inflammation in your back, your neck, and around your vocal cords and your trachea. And I bet a lot of that's going to get better too. How are people treating you?
I've noticed, especially being a small town, it got out who I was before I even got to KU.
Right.
They were able to figure it out from the age and people just talking. And I've noticed people, they'll ask me, how are you doing? It's good to see that you're better. Then they'll hear my voice and they know I'm still struggling with some recovery. And I'll notice, just a look in their eyes, and they'll step back. There's been situations where we're kind of late adopters to masking, and there's a lot of pushback in the area. And I'll walk into somewhere and maybe I'll forget, or because I keep a mask on me just in case I don't take one. I'll notice no one has anything on, but someone will come up to me and say, you need to put one on.
Yeah.
And
So
it's
it's
just,
treating you a little different because they're
Yeah.
afraid that you could still have COVID.
yeah.
Wow. How about your family?
With the family that lives with me, obviously they're pretty good with, I have some issues with visitation with some kids. I've been kept, I stayed away purposefully until I got the negative test.
Yeah.
But even after, I had been accused of trying to infect them or taking unnecessary risks. 2 months later.
Yeah, you're not infectious too much
No,
either.
I think it's, it's the other people who are more risk to you at this point in time.
Yeah.
We don't know what happens if you get reinfected. We hope that you wouldn't have symptoms or have mild symptoms, and certainly not the situation that you were in before. So they're actually more risk to you, and so hopefully they can, it's a little bit of a culture change, and be conscientious of you and your family as well, and really it's protecting other people by wearing the mask.
Did your mom get COVID?
Actually, no, we did antibody tests on my mom and everyone that was in the house.
And nobody else got it?
Everyone came back
Wow.
negative.
And she was in a car ride for 20 minutes with you.
We are hoping that the time that I was on the truck, when I was exposed, was the infectious period. So I was kind of unintentionally self-isolating.
Yeah.
Well, that's right.
And that's interesting too, because what we have seen is that people develop maybe a little bit of symptoms, get better, but then when they progress to the critical illness like you did, we think that's more the inflammatory state. So that's really 7, 10, 12 days maybe after you have the infection. And we think from the best published data that we have, it's a little bit of data, but you really are not infectious really 7, 8, 9 days after your symptoms start. So this really could have been a lot of the inflammatory process, that immune dysregulation that we talk about.
Well, thanks again for coming in here. This is a remarkable story. And it's also a story not of survival, but the struggle from ICU illness and why we want people to be so darn careful, because even though the viral part is done, you still have some of the complications of being so ill. Your voice is a little bit raspy and hoarse, and as you mentioned, you still have some hard time breathing. Critical care is one of those things where you've been so sick, you get really deconditioned, and it takes 6 to 12 months to really fully recover from an episode of severe as yours. And there's a lot of weakness and then some mental trauma that you have to overcome, and emotional trauma. And we see that a lot up in the ICU, and so it's just amazing that you're even right here and willing to tell the story. So thank you.
Yeah.
I think you're helping a lot of people right now. Speaking of which, let's see what questions some folks might have. We'll start with media. Not hearing any.
Hello,
We're gonna
go ahead.
Oh, there we go. Go for it.
Hi, this is Lindsay from 41 Action News. We just had a couple of questions that we've been hearing. I don't know if you're able to speak to the region. When we hear the numbers of ICU patients, can you tell us how many ICU beds we have available in our area to kind of put those numbers in perspective?
Oh gosh, do you remember we did all this
Yeah.
earlier in COVID? I'm
Yeah.
gonna probably have to get back to you the exact. I do have those numbers, but
Yes.
I don't have them off the top of my head. And the reason is that we did all that in March.
Yeah.
And then things got better. Now it's come back. What I can tell you is we have a regional CMO call and a chief medical officer call, and what I can say is that nobody felt short of ICU beds right now. Our fear isn't where we are today, it's what could happen after that, and where we think we may end up in the ICU. It's a distinctly different, we talk about, is this a second surge? Well, I don't know. I don't really care if it's a surge or a wave. But yeah, it's just comes and goes. And the reality is that this is a distinctly different one than the first time we saw it in late March and early April when it was predominantly an older population. This time it's a younger population. We have a lot more Latino folks in the hospital than we did the last time, and we had a lot of African Americans in the first wave, not as many in this wave, and so it's changing. And we mentioned 2 ICU patients and our 2 people on ventilators. And when we did our call last week in the Kansas City metropolitan area, there are everybody has more. I mean that everybody's experiencing a little bit of the same thing where they're getting more folks in. They're younger folks, but I don't think anybody had an overwhelming of their ICU capacity. But we'll have to check on the full number of ICU beds in the region. We have that. I don't have it on.
Yeah, we had a group who was led here at the health system by Dr. Castro, and they all have the surge planning. So not only hospital beds, ICU beds, but ventilators, and sometimes some of the critical drugs, especially that you had talked about, to keep you comfortable while you're on the ventilator. So all of that stuff was done. There was a large collaboration with area hospitals for that.
So we'll come back to you with that answer.
Thank you. I had one more. Also, we had been wondering if you had to rate where we are now in knowledge of COVID-19 from 1 to 10, 10 being we know everything we know and 1 being nothing, where would you put us right now?
Definitely not a 10, and we're
No.
definitely not a 1.
No. And I think that scale changes too.
It does, because every time we learn something, we learn
Yeah.
what we don't know.
There's more questions.
What are you going to
more
say?
answers.
What's your number?
I'm gonna maybe hold firmly at 4 to 5.
Dude, that's exactly where I was going to land, because I think there's so much we don't yet know
Right.
about it, especially when it comes to treatment advances
Yes.
and how it's going to respond to vaccination and how people really recover in the long run. What I will say is that yesterday we were looking at some of our numbers, and I think we've had about 350 unique patients or thereabouts with COVID-19. And we have had 25 people who did not survive. And so that puts our death rate at below 10%, which is good, obviously. And then we've done, like 40,000 tests and I think our positivity rate runs around 7 or 8%. So if you do the math,
Yeah.
our death rate, our mortality rate of the people we test is, under 1%, which is really good, of the people who test positive. And so the challenge is that, there's probably a lot more COVID out there than that because a lot of people don't get tested. And so, I don't know exactly what the mortality rate for COVID is. It's not 40%. We heard that coming out of China initially, especially if you're hospitalized. We're not seeing that. We do better than that. And I think that the therapies with Decadron and others are Lovenox, et cetera, and remdesivir, convalescent plasma. I think all that is making a difference. But I think what we have to remember is even if the mortality rate, if we really knew the case fatality rate, how many people who got it died, it's probably going to end up between 0.5 and 1, which is lower than what we originally projected. The problem is this is such an incredibly respiratory virus. It spreads so rapidly. 15,000 cases in Florida on one day. That doesn't scare you? Yeah, I'm not sure what's going to scare you because that scared me. And, 3 states accounted for whatever the percentage across the world yesterday, and in Texas and Florida and the other one, Arizona maybe. Those are the things that should concern us, is that so many people are going to get COVID-19. They're just going to get it. And so even if the mortality rate's less than 1%, it's still 1% of a very large number of people who get it.
Yeah, and to your point, I think our knowledge today is at 11 compared to where we were 4 weeks ago.
Yeah.
And that goes to how we're dealing with patients who come in. We are trying to hold back and not put them on the ventilator unless they absolutely need it. We have some therapies that we're able to use to augment some of this disease process. So all of that combined, I think the overall, known cases that are diagnosed on the Johns Hopkins tends to be between 4 and 5%. But the full cases, because there are a lot of cases we don't know about, I think just to your point, the last estimate I saw was like 0.65%. So that's between that 0.5 and 1%.
I think
So
that's more for mortality rate. I
hopefully
think that's where it's going to land.
we can continue to get these therapies and really
Yeah.
do the testing, keep people quarantined, really stop the spread. That's
But I think
the
we
full
probably
goal.
have knowledge it's around a 4 or 5 because there's
Right.
so much we have to learn.
And to your point, okay, so we know a small number of cases. We know a small percentage will go to the ICU. But when you have a lot of numbers infected,
Yeah.
that small percentage is a large number. And look what happened when we had 5% of the pork processing plant or industry shut down. What if that's 10 or 20% of beef, chicken, supply chain, all of that stuff? And that's what we do not want to get to.
Other questions? Let's flip over to our listening audience, Jill.
Yes, Cindy wants to know, Anil, do you have underlying health conditions you can share or not share? And do you know where you got exposed?
Obviously, I'm type 1 diabetic, but very tightly controlled. My A1C 2 months after leaving the hospital was 6.7.
Which I want to tell you, that's remarkable because you're on a bunch of prednisone. So to have an A1C of 6.7 after leaving the hospital on steroids is really, 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 for a listening audience, that's spectacular.
So, that was about the only underlying condition other than being a little bit overweight. I would think my doctor joked about, she'd send me a letter once a year and be like, I haven't seen you. And then she'd send me weekly to bi-weekly now, and she's all, this is more than ever.
Tell us what your family business is, you mentioned.
We run a small fleet of trucks, and like you mentioned, meat production, we're primarily delivering fresh and frozen meat.
Okay. What's your favorite meat?
Oh, I'm Kansas, I'm a steak person.
All right.
And Cindy's other part of her question was, do you think you know, and this is back in April, where you might have gotten the COVID?
I look back on where I was at the time and when the symptoms started and tracking back about 5 or 7 days, I was in and out of Louisiana a lot. So I think I might have picked it up.
Yeah,
And there was a real spike early on
We
in
know that they got
Louisiana.
hit hard,
so,
yeah. Everybody.
Donna from Chattanooga, Tennessee, thank you for tuning in. We love that. She wants to know, how much should I worry if I have asthma?
Asthma is one of those pre-existing conditions we do get concerned about, and I think a lot of it depends on the severity of it. Remember that COVID-19 can get you even if you're completely healthy. COVID-19 can certainly make it harder if you got other illnesses. If you're having to be on medications to control your asthma, especially if you need inhaled steroids and other medications to help control it, then you are more at risk for having a more difficult time if you get COVID-19. That doesn't mean that just because you have asthma that you're not going to survive, because that's not true. But it does mean your risks go up. So I would be concerned, and I would do the things we've talked about all along to help make sure you stay safe. Know who's in your bubble and try to control your bubble, because you can do a lot of good. We clearly know that sheltering in place works. It worked here. If we bent the curve, we didn't have many cases. Our inpatient census fell down to 9. It made a huge difference. And so sheltering in place works. Trying to make sure you know who's in your bubble, who comes, who goes, wearing a mask, washing your hands, keeping 6 feet, don't touch your face, cough into your elbow, don't go out if you're sick. All those things. Don't let people in your bubble, especially if they're sick. Those things will really help keep you safe. And the goal isn't to stay safe forever. The goal is to stay safe until effective vaccination's here. And you know what we'd like to say is that, and I'm a bigger optimist, I know I have rose-colored glasses on and people make fun of me for that. But the truth is that I think we're about halfway through this until we have effective vaccination. There are now, as I said, I know there's 2, maybe there's a 3rd company, I believe, out there that are producing mass quantities of a vaccination because they're so confident in how it looks, and it's a fast track. Was it Operation Light Speed for the vaccination?
Warp
I think,
speed, yeah.
or Warp Speed, Light Speed. It's a Star Trek term. I'm all about it, and or Star Wars. And I think that what is going on is that the government is helping those companies ramp up production so that we'll have 100 million to 300 million doses ready by January. Well, that's impressive, and I think we're on track for doing that. So let's make sure that we stay safe. Let's do those things we know that are going to make the difference, especially for people with underlying condition, be it diabetes, be it asthma, be it high blood pressure, be it heart failure, be it COPD, be it cancer. Make sure you stay safe.
Nancy got a call that she ate at a restaurant where they had a worker that tested positive, but she ate at that restaurant 13 days ago. She says, how does this contact tracing work? She didn't quarantine, her family didn't, they didn't know.
Yeah, it's a good question, Dana. Usually contact tracing only goes back 24 to 48 hours, though.
Yep. Yeah. 48 hours. So it sounds like, and again, we've kind of addressed this. The contact tracing, I think that overall our public health systems are overwhelmed right now for the contact tracing. So certainly we would expect for contact tracing to be exposed. They typically go back the 2 days just because of, it used to be 10 days, but they had kind of shortened that just because of the overwhelming of the public health system. So certainly 2 days, it sounds like you've almost completed your quarantine anyways. Hopefully you and your family are not ill.
Really, exposure in a restaurant, it
Yeah.
depends on what your exposure is like. Hopefully you didn't have very much of an exposure, but yeah, 13 days out, you should be pretty safe.
Yeah.
You know, this contact tracing thing and trying to make sure people stay safe, this is an example of where our public health system has been in disrepair a little bit, and as a result, we're not as well prepared for this epidemic. And I think one of the things we have to learn from this is how are we going to approach public health going forward? And in the next few weeks, we'll be addressing some of those questions when we get some more public health officials on the program. And just to say, Lee Norman will be with us tomorrow. Lee is a good friend of ours, and he's a secretary at KDHE, and he's going to talk to us about testing, supplies, numbers across Kansas, so make sure you join us for that. But that's going to get into a bit of a public health question. We have to think about what is the role of public health in our lives.
Carla is overweight and has diabetes, or she knows someone who is, and she wants to know if that person is going to survive. I guess if we look at Anil, we would say yes. But she also says she has a type A blood and wants to know, does that help or hurt her?
Well, you know what, Carla, is that right?
Uh-huh.
Carla, you and I both have type A blood, so I looked at that with pretty big interest when this is coming out. Do you know what your blood type is?
I do not.
No, okay. I just thought maybe you'd learn it when you're in the hospital. That, you know, the type A blood was a risk factor. I think that's now kind of fallen off the wayside. More prospective data
heard too much about it.
is that kind of went away. Also, it was we were kind of messing around and had teasing a little bit last week. You know, there was a report that came out that said some people have about 6 genes, or it's really a gene sequence, it's not a full gene, that were passed down from Neanderthals, and that made you more at risk. Now, I don't know if that's going to bear out to be true either. I believe my wife believes I have those, and so maybe I'm more at risk.
That's right.
I think that but I think the answer is a blood type probably isn't a big risk. The other things are more of a risk, and it just points to the truth that whatever the virus, whatever the infection is, things that make us less healthy at baseline put us more at risk for that infection. So if you have diabetes or high blood pressure, or you're overweight or deconditioned or COPD, or you're a smoker or you drink too much, those things which we know affect our daily health anyway are always going to make it worse when we get sick and make us more susceptible to bad outcomes. So I think the more you can do to stay healthy, the better off you are.
Liz wants to know if being on 2 immunosuppressant medications for autoimmune disease mean the same thing as being immunocompromised.
Yes.
Yes, it does. It does. And we have seen patients who are on hydroxychloroquine for rheumatoid arthritis. They don't have any protection from COVID. They still get severe illness. We've seen other people, especially transplant people, who are on immunosuppressive drugs. They are also susceptible and at risk to severe disease as well. So, but yes, the short answer is we would consider that immune compromised.
Yeah, and there was some hope initially that maybe if you were on those drugs, you wouldn't get the inflammatory syndrome, but that doesn't turn to look so
doesn't
true.
seem, yeah.
folks can still get it, and we know there's some data out there about kidney transplant patients who get COVID-19 don't do particularly well. There's some other data out there that says other transplants do okay. So it's kind of a mixed bag, and the reason we're picking on transplants at this point is because to answer that question, they're usually on 2 to 3 immunosuppressing medications to keep their organs alive.
Quinn wants to know if Anil can get sick again with COVID.
Yeah.
Anil, do you think you get sick again? Let me ask, what do you think?
I hope not.
I hope not for you as well. But Dana, we don't really know the answer to that.
You know, that is a great question, and that is what we are hoping to answer as we move forward. Just as we stated before, you know, other people around you in your community pose a risk to you because we don't know what happens if you get re-exposed. You know, from some early data from South Korea suggesting that it's not reinfection that you get, but maybe just the inflammatory symptom. But what happens when you do get re-exposed? Are you going to get no disease? Are you going to get mild symptoms? Will it be attenuated where you actually get worse symptoms? I don't think we know that yet. We need to look for all those answers. So it's very important for everybody to be wearing masks, to be physically distancing and all that, because we don't know. And we certainly don't want to have you back on the ventilator in that critical illness situation.
Well, we know, we think it's going to be. I mean, most coronaviruses
Yep.
you have a little bit of protection from, so we hope that that's the case. And that's the whole reason to
Yeah.
go ahead and do vaccination. And at least in some of the preliminary vaccination, it's very preliminary, small numbers. Well, in the animal models, it was protective. In human data, it looks like it may be, but again, that's really early, and we got a lot more stuff to learn about it at this point.
Trey wants to know, are people with neuromuscular disorders at higher risk for complications from COVID?
Yeah, I think the answer to that's going to be yes, because of the same story. You're going to have a harder time responding, and if you have neuromuscular disease, your breathing may be a little impaired, and you may have some difficulty around that. So I think the answer, or even coughing, getting rid of secretion. So I'm going to say the answer to that is yes. And sometimes we don't even know all the diseases we have, Dana,
Right.
which means we really have to practice hard those key principles of infection prevention and control, which you know well.
Yeah, absolutely. Continue to do those. Physical distance, don't gather in large groups, wear masks to protect yourself, but mostly to protect others. And obviously, hand hygiene is extremely important.
Gail has 2 sons, both have Crohn's disease and are on Remicade. Is there any evidence that they are at higher risk?
What do you think?
I don't know if there's published evidence per se, but I would say yes. You know, higher risk certainly for the probability of going to hospitalization or critical disease. Doesn't mean you're going to, but I think the risk is definitely there.
Anila, are there anybody in your family that lives with you? Do any of them have underlying diseases?
Actually, no.
So that was maybe one thing that was helpful in that they didn't get COVID-19. Did your family, were they wearing masks? Did they have good hand washing? Talk to us a little bit about that.
Well, they were definitely doing the hand washing.
Yeah.
I know my wife she's normally pretty fastidious when it comes to Lysol and cleaning, and kind of think the girls are kind of germaphobes a little bit. So that may have protected them in this situation.
I bet it did. And as you look out around the country, the community, you see people not wearing masks. What would you like to say to folks?
Well, I would encourage people to be more careful. You know, I see a lot of conversation about the survival rate, and I definitely think there's quite a large misunderstanding on what recovery means. And from what I've seen on some survivor groups and whatnot, and people talking, there's quite a long road back.
Yeah.
Even for people that have minor to medium, you know, maybe not as severe as mine, but even people that are on oxygen or have lung damage or that go through it, they have long-term complications. And I don't know if we really, I think like you stated, I don't think we really understand what those are just yet. And the worst thing you want to be is the guinea pig. You know, that's, I think, for us and me mentally a little bit, the hardest thing to find out is every time I asked anyone any questions, like how long is this going to last, or what's the next stage, or, you know, what's going to happen, and everyone's answer is they don't know.
Yeah, I don't know. That's a frustrating answer for patients to have to hear.
Oh yeah, and I'm kind of type A, and I like to see an end goal and a plan, and it's kind of hard to progress, and, you know, it feels like taking a lot of times 2 steps forward and a step back, and
Yeah.
kind of bouncing back and forth without, I mean, there's direction, but there's not, I've had neck surgeries and I've had back surgeries, and we kind of had schedules and goals, and we knew where we were going to get and how we were going to get there. And with this, there's no answer as to what's going to be permanent.
That's a hard thing to do. And yet another reason why people should take good care of themselves out in public by wearing masks and doing the things we know they need to do until vaccination and or effective therapy arrives. And it's going to arrive. We're going to get there. But that's got to be hard. And that lack of knowing is one of the hardest things, I think, for patients.
Yeah, I'm sure not just for patients, but even people around me.
You bet. You
A
bet.
friend of mine told me, because I got frustrated with the way people had dealt with me, or I'd even got denied services somewhere because of, I was 2 months out from COVID, and my throat was, I got an apology from corporate, but it was, definitely got me really aggravated.
Yeah.
And like my friend had told me, he said, it wasn't about me. It was that they weren't taking it seriously. They weren't taking precautions. And if they would have been doing the same thing every time, then when they interacted with me, it wouldn't have been as frightening.
Yeah.
And, it made it very real. Because I've heard that a lot, like, oh, you're the first person I met.
Mm-hmm.
And I know with my team, the people that work for me, I beat it in their heads regularly, to be careful. And I know it's changed their attitudes, and it's probably kept us safe as a company.
Yeah, I
Well,
bet it
that's
has kept your
You've probably
safe
helped their
as a company.
families too. Right?
Yeah.
Well, like I said, they know a plasma donor now. So,
Are you a plasma donor now?
not yet.
Yeah. Well, get a little healthier before you do it. and then
Well,
you
I
can.
could give it to them, is what I was thinking.
No, that's true.
Yeah.
That's true.
That's right.
Do you have time for a couple more?
Yeah, a couple more.
All right, so Jennifer, she's got a teenager at home that has mild symptoms, no coughing, some sinus issues, low-grade fever. Question is that person contagious, and for how long?
Yeah, so certainly for children and pediatrics, overall, we think they may be less infectious. We certainly know for the majority of children and pediatrics, they will not get the severe disease in the proportions that adults do. Certainly based on looking at contact tracing in households, it seems that they are not as infectious as adults. That's a lot of indirect evidence. Also from some new data from Belgium and I believe Japan, when they have restarted schools, they haven't seen any known new clusters or outbreaks with that, but again, it's still early in that phase. But as far as the amount of virus that a child is expelling, really a couple studies really just show, and one is from one of the CDC publications, that show that they seem to express the same amount of virus that adults do when they look at viral titers in saliva or sputum, which is kind of what you cough up or spit up. They seem to have the same or similar amounts of virus in that compared to adults. But luckily, so far what we've seen, again, from indirect evidence, is they aren't as infectious, but everybody needs to continue to take precautions to prevent infection because we know it can happen.
Last
And
question, I think.
Dilsa says that she has been sick since Wednesday. Today I'm feeling better, just tired and headache. Should I get tested?
I think if you're tired and headache, you need to get tested. I'm glad you're feeling better, by the way.
Yeah.
But I think you just have to assume that almost any symptom can be COVID. And
Yeah.
as we know, fatigue is clearly one of them. That was one of your first symptoms. You said you were tired and fatigued, right?
Oh, yeah. I mean, it started off, we were certain for a day or two it was just allergies.
Yeah.
And then, obviously, looking back, the oxygen loss and the fatigue was definitely a big red flag.
A lot of times the fatigue will be really a loss of oxygen, and you just don't realize how that affects you, especially when you're sleeping at night. Anil, I just want to say thank you. I think it takes uncommon valor to come down here and talk about this, and to even come to a hospital after you've had COVID-19 and worry about you getting it again or whatever else. I do think hospitals are really safe right now, far safer than even we were before the pandemic.
Yep.
But I think it takes still uncommon valor to come down. So I want to say thank you. As our program ends and winds down today, what final thoughts would you like to leave our listening audience?
Just be careful, be safe. You don't want to be in that position. I don't know if I had one nurse the last night I was here, Adam. I don't know his last name. I think I was on the 62 unit. He really encouraged me that last night. It's definitely a rougher night getting back to normal. And, I just want to say thank you to everyone that was here. I'm glad I'm still here because of everyone here.
We're glad you're
Absolutely.
still here too.
Absolutely.
We're glad you're with us this morning, so thank you. I just can't tell you how much that means to me and to us and to all of us who work in this space. It's great to see you here, and thanks for coming in. Final thoughts, Dana?
Yeah, we are continuing to see exponential spread, as you talked about. A lot of states continue to have it. Obviously, Florida has a lot more spread than some countries. So, what are we doing different? Certainly there are differences in the United States compared to other countries that don't have as big a population, don't have as big a landmass and everything. I think we all need a full culture change and direct it towards getting through COVID, stopping the spread. It's not a political issue, it's a medical issue, it's a health issue, keeping everybody healthy, keeping you healthy, your family healthy. So if we can work towards that, the mask use, keeping everybody healthy, not gathering in groups, washing your hands, all of those things that we've talked about is really moving forward how we are going to be able to decrease or stop the spread and get back to the things that we want to do. Go to Kaufman, go to Arrowhead, have our kids back in school and everybody be safe. And so it's going to take one step at a time. We have to continue to have the collective United States population doing those things.
Yeah, I think that's right. And I think we need you all to be a Neil Garmonger. We need you to go out and tell the story and believe that it's true. We don't want to make you all sick, but we want you to be thoughtful and reapproach it. There's all these things about the country shutting back down again, and it feels
Yeah.
like such a big setback, and it's never going to really end. And, that's not the way it is. What it really says is we have to be careful. What we didn't do is we weren't careful. We got a little careless, got a little reckless. And, when you go back to a bar and you're drinking, you lose inhibition, you start getting close to everybody, and everything thinks it's a big party, and that you're not going to get sick. You see, that's just wrong. There's a lot of evidence out there that says you can reopen. You just have to do it in a thoughtful, conservative way and not go right back to norm, because it's not normal. It's the post-COVID world. And we're not in a post-COVID, it's still a COVID world. And we want to work toward a post-COVID world. And it's coming. Don't get impatient. I think we're at least halfway through this. So let's work together to make sure we're all like a Neil Garmonger. And I don't know how I just said your last name that time, but let's be sure that we stay safe. And we can do it, but we have to take care of each other. And we have to get out there and wear our masks, be staying sheltered in place when you can, keep your distance. And most of all, just be thoughtful and considerate of others. Because if we follow the basic rules of what we learned in kindergarten, we're going to get through this just fine. So until we see you back here tomorrow, just remember, there's still no place like home. Thanks for being with us today.